no, perdona, es mi problema. No hay problema, es algo que, perdona, no hay problemas, está.
So welcome everyone to our third day of our series of G2H2 policy debate ahead of the Executive Board. My name is Alessandra Tisi and I am the Executive Secretary at G2H2, Geneva Global Health Hub. For those of you who do not know what Geneva Global Health Hub, it is a network of civil society organizations that was created in 2016 with the aim to provide a space to enable civil society, but also research institutions and other entities to meet, to share knowledge, to create initiative, to engage in common advocacy and common research projects. If you wish to know a little bit more about the Geneva Global Health Hub, or you would like to become a member, please let me know. I will put my email address and the link of the G2H2 website in the chat, and I would be very happy to welcome you in the family of G2H2. Today, we are here with our fifth meeting of our series of G2H2 policy debates. As you can see in the agenda on the screen, it is a full week of different meetings, of various meetings on various kind of topics. We do have some meetings who cover executive board items. We also have other meetings that do not cover executive board items, but that are matters that nevertheless matter to us. Today, I am very pleased to present to you this very interesting session on glyphosate and antimicrobial resistance, which this session has been co-organized by Society for International Development, and it's moderated by Nicoletta Dentico. Just before giving the word to Nicoletta, a few housekeeping rules. The session is in English and in Spanish as well. You should see in your Zoom setting a little globe. If you click on the globe, you can choose the language of your preference. The session is recorded, so from tomorrow onwards, if you go on the website of the event that I will also put on in the chat below, you can listen to the recording of the session as well as have access to PowerPoints and all supporting documentations. To engage in the discussion, please raise your virtual hands and then we will unmute you and give you the possibility to speak. And then you're free to use the chat to present yourself, share questions, remarks, or whatever. Without further ado, I will now give the word to Nicoletta, and I wish you a good webinar. Thank you so much.
Thank you very much, Alessandra, and indeed, welcome, a really true welcome to this webinar, and sincere gratitude for all the people that have made this online event happen, and particularly to the outstanding round of panelists from Europe, from Africa and Latin America that are here with us today and who have not only accepted our invitation, but also asked us to co-promote this event, which I really take it as a great indicator of joint action. As you know, as you can see, SID is organizing this webinar with Ecosur, and therefore Cecilia Elizondo, and also with Seatini in the person of Jane, who is going to speak, but I will introduce Jane later, and Cecilia. Let me introduce myself first. My name is Nicoletta Dentico. I am the director of the Global Health Justice Program at Society for International Development. but I also co-chair this independent platform that is the Geneva Global Health Hub. And also allow me to introduce the person who, with me, will be co-chairing this, co-moderating rather, this online event. I'm talking about Cecilia Elizondo. Cecilia Elizondo is an academic from El Colegio de la Frontera Sur, ECOSUR. She is a member of the steering committee of the high-level panel of experts on food security and nutrition of the United Nations Committee on Food Security. At FAO Mexico, Cecilia coordinated the intersectoral group on health, food, and environment, and she has had a long experience on environmental management and public policies in Mexico and in Argentina. She belongs to the National System of Researchers of Mexico, Level 1. So I'm very happy to have Cecilia with me today to unfold this very, very important conversation. Just let me sort of add a few words on this topic. This is not the first time that SID wants to trigger a conversation, a debate on glyphosate. We consider that glyphosate is a crucial topic, among others, of course, not just for its symbolic, but primarily for the systemic injustice it embodies. The vast use of glyphosate in the world, along with many other toxic chemicals, is totally embedded in the industrialized agricultural model that we live in. And we know that glyphosate and the agricultural model that is associated to this form of capitalism is simply spreading diseases and fueling the antimicrobial resistance pandemic, simply because glyphosate, a notion that perhaps is not so well owned by many, is registered in the US as an antibiotic since 2003, and it is registered as an antibiotic in Europe since 2014. So it is important to discuss this topic ahead of the executive board of the World Health Organization, because when we talk about antimicrobial resistance, the main discourse is only about research and development of new antibiotics. And no one is actually looking at one of the major drivers of antimicrobial resistance, so the elephant in the room. Glyphosate is the elephant in the room. We want to name it, we want to identify it, and possibly shame it. Ahead of the World Health Organization, EB, everybody talks about One Health. And we, in this webinar, want to pave the way to policies and practices that have been enacted in countries and that are actually truly advancing One Health. Not the notion of One Health that is dominating the discourse in Geneva, mainly associated to biosurveillance and to digital structure of control. So we discussed this topic once again because the WHO seems to be quite dormant in the face of the evidence that has come from scientific research. And of course, we will hear more from this from our panelists. Research that is, by the way, confirmed by the 100,000 Roundup cancer lawsuits that Monsanto, which is now owned by Bayer, had to settle in the past years, paying something like 11 billion to cancer survivors as of May 2022. There are still 30,000 lawsuits pending, according to Forbes Advisor in 2023. And while poisonous multinationals are mired in litigations, as I said, new scientific evidence has been building up to prove the correlation between the use of glyphosate and cancer. So AMR, antimicrobial resistance, and spreading cancer. To finish my introduction, we have decided to intercept important events that are happening in the world on this topic. And we were kind of, blown up by the news that we saw in the media during Christmas time, during the season's break, that a major action was taking place in Europe. And that is the Pesticides Action Network that in Europe that has basically decided to bring the European Commission to court for its extension of the use of glyphosate for another 10 years. But this is not me to say this. It is actually Angeliki Lysimakou from Pesticide Action Network. Welcome, Angeliki. Angeliki is an environmental toxicologist with over 15 years of experience in the field of endocrine disruption related to aquatic animals. She has a degree in environmental science and a PhD and she completed her PhD in the Consejo Superior de Investigaciones Científicas in Spain on the mechanisms of endocrine disruption in fish and mollusks. She has worked in different laboratories in Europe as a researcher, including in the UK, Greece, Spain, Norway, and Portugal, in several scientific disciplines. Since 2014, she has worked for Pesticides Action Network, and her work is focused exactly on endocrine disrupting pesticides. So it is with great pleasure that I'm giving Angeliki the floor. Thank you so much.
Thank you, Nicoletta, for this great introduction. I'm very pleased to be among you today and to present our legal case on glyphosate. It's a lot that I can talk about on glyphosate since we've been working on this for more than 10 years, but I will keep my time into the 10 minutes that we promised. So I will share 1 minute my presentation. Okay. Can everybody see that? Yes? Yeah, great. Okay, so a couple of words for those not familiar with my organization. We are Pesticide Action Network Europe is a regional office of a global network that we're fighting to ban toxic pesticides from agriculture and replace them with alternatives that are safer for human health and the environment. We work also, we focus a lot at the European Commission, so we're looking at the European processes, and we have members all around Europe. And we also try to stop the export of pesticides that are very hazardous to third countries. Today I've been invited to speak about our work, our legal case that we started about glyphosate in Europe. This is a work of a collaboration with our members, 5 members specifically, and other experts, scientific experts that are working on specific issues. Okay, so just a little bit of background. Nicoletta already mentioned that a landmark for our work on glyphosate was in 2015 when the International Agency for Research on Cancer classified glyphosate as a probable carcinogen. And it looked all the scientific literature, and it found the three levels of evidence. So they found evidence on humans from epidemiology studies where they had developed non-Hodgkin's lymphoma. They found from laboratory animals, from studies also done by the industry themselves. And also they found strong evidence of mechanism of action. This means genotoxicity. So the capacity of glyphosate to interact with DNA. So now, why that was alarming for us, especially because according to the European law, which is in force since 2009, pesticides that they fall under this hazard class, that they are carcinogens, probable carcinogens, they must be banned from the European market. And this also includes, of course, other hazardous pesticides that they also toxic to reproduction or endocrine disruption, for example. So the regulation is very strict and very clear. So for us, it was really surprising that despite all the efforts we did and trying to bring all this evidence to our policymakers, then in 2017, Europe decided that actually the evidence is not enough to classify glyphosate as carcinogen, and it gave a 5-year approval. And 5 year is a very small period for pesticide, and this was exactly because of the citizens' concerns and also all the political debate that the discrepancy between IARC and Europe had brought. So, long story short, we had another application, this time from Bayer and not from Monsanto, because in the meantime, Bayer had bought Monsanto. And we also had all the court cases in the US. And this time we were much more prepared. So we brought the scientists from the very beginning of the discussions into the committees to present the evidence on cancer, on genotoxicity. These were our main focus, but we also presented about endocrine disruption and impact on microbiome. And again, the decision of the European institutions was that glyphosate is not carcinogen, and it also doesn't cause any other harm to human, animal health, or the environment. And as a result, they gave this time a 10-year approval. So we don't even have a 5 years, but we have a whole 10 years. So this, of course, yes, this brought, we were very upset about this. So we decided to look more thoroughly into this assessment and present an analysis that we could then carry, let's say, start the first step of what would be a legal procedure against this decision of Europe to authorize glyphosate for another 10 years. So together with different type of experts, we looked in detail the thousands of pages, like because we're talking about like thousands and thousands of pages of studies that have been done on this substance specifically. And we found what we call serious shortcomings. This is actually major errors in the assessment, the scientific errors. And we found, for example, on genotoxicity, we saw that most of the studies that they were reporting that glyphosate is genotoxic, it affects the DNA, were excluded from the assessment at the very end, or they were, let's say, downgraded. So they were found less relevant. Now, for carcinogenicity, we looked the same studies that IARC had looked, but also additional studies that the European Commission had, like the agencies they had in their hands, that they were undisclosed. They were, undisclosed before. So, and we could see that they were evidence that the animals had produced tumors. And looking into the details, we saw that actually they hadn't followed the international guidelines. They had used the wrong statistics, and at the end they had dismissed all the adverse effects they had seen on cancer as non-relevant to glyphosate. So this was for us a scandal, and we are describing it very well in our analysis. And of course, not taking into account the genotoxicity, they also said there was no support on the mechanism that they could cause cancer. And of course, on this, I have to say that all the epidemiologist studies, they downgraded them as well, as is completely incidental. Something that we didn't see in the 2017 and we saw here was the neurotoxicity. And here what we saw is that there were a lot of evidence in the scientific literature, enough at least to bring a concern and raise some serious, like either do additional tests or ban the substance altogether. So these were during early development. We also even have an industry study that shows that glyphosate salt cause developmental neurotoxicity, as it's called. And this is very serious because it can be linked to autism in children. But of course, we also found evidence for Parkinson's disease. So when this evidence were brought to the European institutions from experts, they were rejected as non-relevant or incidental again. Like they didn't really have, they were done by chance and they were not conclusive. Of course, as we heard before, there was glyphosate is also is patented as an antimicrobial agent. And now we know the impacts that this can have on the health and the immune system. And there were dozens of studies showing that glyphosate has an impact on microbiome. And these, although they were looked at by our risk assessors, they were saying, oh, but it doesn't really cause any problem. And very easily they were dismissed and they were concluded that this was not a health issue. Now, looking also the gut-brain relationship and how impacts on the microbiome can then link to impacts on the nervous system, it could explain all these studies that they're reporting impacts, the link of glyphosate to potentially to autism and Parkinson's disease. This was for us is really worrying. Very similar approach they had for biodiversity. We know that glyphosate, it kills all plants. It kills everything in the field. So for us, it's very straightforward. It will have an impact on biodiversity. But this was, again, really downgraded by our risk assessors. And they said that the overall, they dismissed that all the evidence that we had. And final, which is not a small issue, is risk assessment is done on the active substances and not on the whole products that farmers are used and is what is sprayed in the field. So when we're looking in the assessment of the whole product that has inside conformulants, adjuvants, and so on, different ingredients that help to increase the toxicity of the efficacy and therefore the toxicity of the pesticide, they're not tested for long-term toxicity. So we don't have any tests on long-term toxicity. And when we do, and they come from independent scientific literature, these are found as less relevant for the assessment. At the end they don't take part in any, they don't affect the conclusions. So it's still like, despite all this evidence, there's still glyphosate is considered safe. So here I'm just wrapping up the different shortcomings in the scientific assessment that we found. So above all, we found that the independent scientific literature is not really taking into account. Even if it's included, then it's afterwards excluded. We found serious deviations from scientific standards and protocols, misuse of statistics. This is what we say as the devil is in the detail, because you do have to dig really deep to find these errors. We found an incomplete risk assessment because, as we said, the whole products is not tested for long-term toxicity. And because of using as an excuse that they didn't have a guidance, then they excluded all impacts on biodiversity and microbiome. So for us, this is a pure violation of the precautionary principle, which is the principle that covers all the chemicals legislation that aims above all to protect human health and the environment. So for us, glyphosate reapproval is in clear violation of the EU law. So this is why, together with a lawyer and 5 of our members, we decided to take action. And what we did is we sent this analysis that it was very briefly presented to you today. We sent it first to the European Commission through a legal avenue that we have, that we can request the Commission to review one of its regulatory decisions. So in this case, it was the approval of glyphosate for 10 years. So we sent a request. Then months later, the Commission replied to us and they said there was no problem with the assessment. So they looked into it and they denied that there was any shortcomings with the assessment. So because we want to stop this ping pong exchange that we've been having for the 10 years, now we do have the opportunity to take them to the European Court of Justice, which is exactly what we did. We submitted it in December and it's officially going to be accepted now in January. So we have asked the European Court of Justice to intervene. Now, this is, we're challenging the 10-year approval. We don't know exactly what the result will be because we cannot ban as citizens glyphosate. What we can do is we can ask the Court of Justice to ask the Commission to review this approval. So it's going to be a long procedure. We are expecting interventions from the industry, Bayer, that will support the Commission in this case. We don't know exactly what the results, but we feel that this is a matter of health and a matter of the protection of the environment. So it's our duty to seek justice. And with this, I would like to thank you. And I'm looking forward to the discussions and the presentations from the next speakers. Thank you very much.
Thank you so much. Thank you so very much, Angeliki, for giving such a detailed background and updated information on how, distortions can occur for, of course, a corporate culture of even scientific processes, and also how difficult it is, what a struggle it is to bring the real science to the fore. So I think it's very important to hear this from you. You are talking clearly about the violation of the precautionary principle, which is one of the, milestones of European legislation. Doesn't exist perhaps in many other parts of the world, but we are losing it. So the stakes are so much higher than the very important struggle that we are now discussing about. And also very much thanks for, giving us the opportunity to know that there is a new opening to bring cases to the European Court of Justice, which should not be limited, is not limited only to European actors. So this might open a new way. But I will now, thank you so much, therefore. This was a fantastic beginning to just enter in medias res, as the Romans would say. And I give the floor now to Jane Seruwagi Nalunga from Seatini. Jane Seruwagi Nalunga is an expert on trade, fiscal, and investment-related issues. She has a vast experience and expertise in analyzing national, regional, and international trade, investment, and fiscal-related agreements and policies on climate change, gender, human rights, and food security. She has more than 20 years of experience in policy research, analysis, and advocacy. And she is currently the executive director of Seatini Uganda. Seatini, like Pan-Europe, organized very important events in January, which is a breakthrough beginning of the year. And I leave the floor to you, Jane, to tell us. Thanks. Jane? We've lost Jane.
No, I'm here.
Okay. Oh, great. Okay, and we see you now. Perfect. Please, you start.
Okay. Okay. Thank you so much, Nicoletta. And can you hear me?
Yes, indeed, we can. Indeed.
Okay. First of all, I would like to thank the co-organizers of this meeting to give us a chance as Siatini to share our experience on these issues around the hazardous pesticides, including glyphosate, and also share the actions we have taken so far. Maybe before I go into my presentation, just to say a little bit about Siatini, that Siatini, we are Southern and Eastern Africa Trade Information and Negotiations Institute. We work in Eastern and Southern Africa on economic policy issues, trade, investment, agriculture, but also health and education, because all those issues have been put in the marketplace. They are traded over, they are haggled over and taken over by the highest bidder. So we link trade to health issues and to other social services. So that's who we are, and that's our link to health issues. I would like to give a brief background to Uganda's context. And this context is the same for almost all of Africa. For Uganda, almost 80% of our land is arable land, although just 35% is cultivated due to a number of challenges. And most of the households, 62% of the households are directly engaged in agriculture, according to the 2024 National Census Report. Our agriculture is highly dependent on rain, and it's carried out almost 90% by small-scale producers, small-scale farmers. According to FAO, the global yield has reduced, and one of the reasons are plant pests and diseases, and this has also constrained Uganda's agricultural production. Another fact which we need to look at is the fact that the total quantity of agricultural subsidies used in Uganda has doubled in the last 12 years, from 2,990 tons to 6,000 tons, and that's according to FAO. And even the monetary value of pesticides imported into Uganda has more than doubled, from 32.57 million to 75 million in 2022. So that context is really important. And according to the Food Safety Report, by 2023, at least 115 active ingredients and 669 brands of synthetic pesticides were legally registered for use in Uganda. Of these, up to 55 active ingredients and 459 brands, including glyphosates, qualified as highly hazardous pesticides, according to the Pesticide Action Network. For me, I think that's really very important. The amount of highly hazardous pesticides in Uganda. So the top 5 exporting countries with the highest rates of samples with EU banned pesticides were India and Uganda at 18%. So what are our key concerns given that background? One is the fact that the EU's exports of banned pesticides are mainly destined for low or middle-income countries where there are weaker environmental and health protection laws in place. And for us, this is really unacceptable that pesticides are banned in the EU, but they are exported to our countries, which endangers health of the people and the environment in importing countries. That table shows the top 10 imported pesticides from Europe, and glyphosate is the one at the highest. Another key concern is the peddling of the false solutions for Africa's problems. We are told that if Africa is to address the climate change concerns, if we are to feed the growing and hungry population, we need an industrial agriculture system. And this system requires what we call improved seeds. These are most often GMOs, intensive pesticide and synthetic fertilizer use, monoculture, so that's the solution they are giving us, that Africa, you are hungry, there's a huge population, this is what you need to do. So you find that there is a contestation in the entire Africa between industrial agriculture versus agroecology. Where do we go? That's why you see in most of our policies, there is also a contestation, for example, between farmers' rights and breeders' rights. And you find that most of now the policies, agricultural policies, are skewed towards breeders' rights and towards monoculture fertilizer use. For example, we have the International Union for the Protection of New Plant Varieties, WUPOV, which has been adopted by over 40 African countries. We also in Africa have other plant varieties laws. Most countries have adopted these laws which protect the rights of the breeders. Other countries, for example, Kenya has outlawed farmers' right to protect and share seeds. In fact, there is a penalty of being imprisoned, I think, for 6 months or paying about $7,000 if you are found exchanging seeds. There is also contestation among scientists in Africa. There are those who are saying that glyphosates and all these pesticides can't cause cancer. And the contestation is on that word probable. That probable doesn't mean that it causes cancer. We also have very weak and skewed regulatory and policy frameworks. For example, in Uganda, they put in place an Agricultural Chemicals Control Act. That was in 2007, but there are no regulations to implement it, and it hasn't been implemented. There are also weak institutional capacity. For example, they put in place an Agricultural Chemicals Control Board in 2007, but it has never issued any status report on the trade and use of dangerous agrochemicals in Uganda. I have already talked about in the ESC, Kenya, which outlawed farmers seed saving, sharing and exchanging, producing and multiplying under their Plant Varieties Act. They are liable to a prison sentence of up to 2 years and a fine of around 1 million Kenya shillings, which comes up to $7,700. So they can give you both penalties.
Jane, you have another 3 minutes.
Okay, another concern is the limited awareness about the dangers of hazardous pesticides across the entire value chain. You see that man, the way he's spraying, he has no protective gear, spraying vegetables, spraying near the spring, that water goes, the second person is drinking the water, and these are the products on the market. Some of our actions, we have established networks, alliances, and platforms to challenge the narrative. We have engaged in advocacy and campaigns. We have raised awareness, and we have also carried out some litigation together with other civil society to challenge government's inaction and its failure to regulate the import, trade, and use of glyphosates in Uganda. This case is pending. It's pending. It hasn't yet been concluded. Way forward, briefly, I think as Africa, we need to clarify on the way forward what kind of agricultural model do we need. We need to strengthen regulations and legal frameworks, but we also need to campaign, continuous campaigning. We already have some campaigns ongoing. For example, Life Before Profit. And if it's banned in the EU, it should not be exported to other countries. And we need to enhance awareness and advocacy. And we need to bring everybody on board. Thank you very much.
Thank you so much, Jane, for bringing the experience of Uganda and the very, the very pictures of what the reality of spreading glyphosate is in Africa. And the same applies, of course, to other pesticides and chemical toxic ingredients. Thank you so much. Also, because in a way you are, balancing the struggle from the European groups. But if we win in Europe and we export to Africa, the battle is still not won. It's not a victory yet. And I think also Angeliki previously mentioned this, and I think this has to be seriously brought to the fore when conducting the court case in Europe. So thank you also for the great mobilization that you're engaging in, and we will definitely have to continue on this activity. Now, I see already that there are some questions on the chat, but I will now give the floor to Cecilia to introduce the Latin America component of the panel. And let's try to keep the timing so that questions may be raised and answered. Thanks, Cecilia.
Thank you, Nicoleta, and thanks all the speakers till now that were wonderful. So we have now Erika Hackman. I'm going to switch to Spanish. Ella es bióloga de la UNAM, recibida con honores y ha recibido diferentes premios también. Trabajó hasta el 31 de diciembre en la Comisión Intersectorial de Bioseguridad y Organismos Genéticamente Modificados, que es CIBIOGEN, aquí en México, que es la agencia gubernamental que establece las políticas de seguridad de biotecnología relacionadas a los OGMs. Sus investigaciones se han enfocado en conservación biocultural de la milpa, el papel de las mujeres y el maíz nativo, y los impactos transgénicos y de plaguicidas. En sus 8 años de experiencia, el servicio público ha promovido la bioseguridad de los organismos genéticamente modificados, la soberanía alimentaria en foros nacionales e internacionales, pero también lo importante de ella es que ha sido parte del grupo de negociación de la controversia que tenemos en este momento con Estados Unidos, con el Tratado de Libre Comercio, que tiene mucho que ver también, como comentaban recién, con el tema de principio precautorio. Ella presentará esta experiencia de México y para no robar más tiempo, adelante, Erika, por favor, te avisaré cuando queden 2 minutos.
Muy bien, muchísimas gracias. Ahora voy a compartir la pantalla. Pienso que ahí ya están viendo, ¿no?
Sí,
bueno,
perfecto.
Muy bien. pues yo les voy a compartir la experiencia de México justamente pues para tratar de restringir el glifosato y el maíz transgénico. Todo esto con el propósito de proteger la salud, el ambiente y la riqueza biocultural por encima de los intereses del oligopolio industrial, porque hay que decirlo y recordarlo, son 4 empresas a nivel internacional las que controlan justamente pues todo el mercado de los agroinsumos, dígase semillas, fertilizantes químicos, plaguicidas e incluso maquinaria, ¿no? Y bueno, importante decir que estas medidas del Estado mexicano no se pueden entender, ¿no? Sin mirar de dónde vienen las decisiones que se tomaron, ¿no? Durante el sexenio pasado. Primero, el reconocer que el maíz viene en realidad de la sabiduría, el talento, las técnicas, la ciencia también, porque hay que decirlo así, de los pueblos originarios que domesticaron el maíz y lo diversificaron por milenios y hasta la actualidad. Son ellos los verdaderos autores intelectuales, ¿no? de esta diversidad genética precisamente, que más adelante además pues es privatizada, ¿no? A través de figuras de propiedad intelectual, tal como lo dijo la compañera que me precedió, ya sea obtenciones vegetales, patentes o en sus inicios incluso pues de marcas, ¿no? Que fueron los primeros híbridos comerciales, ¿no? Además, pues su cultura, conocimientos y tecnologías han llevado a conservar en vivo los maíces nativos frente a toda adversidad, porque cuando en México ingresaron los primeros híbridos comerciales, en esto que se le llamó la Revolución Verde, impulsada por sobre todo la Fundación Rockefeller y Henry Wallace, que fue vicepresidente de Estados Unidos y también ministro de Agricultura, se anunciaba que los maíces nativos se iban a perder. Sin embargo, no se perdieron. Y luego, cuando ingresaron los transgénicos a México, también se anunció que el maíz nativo posiblemente se iba a perder y no se perdió, se sigue conservando, ¿no? Entonces, todo esto ha gestado precisamente que cuando ingresan los transgénicos a México, particularmente a mediados de los años 90, cuando se empieza a sembrar maíz transgénico en México, con las preocupaciones de la academia, porque además lo de la siembra del maíz transgénico era muy oculto, las preocupaciones de la academia se empiezan a difundir y entonces esto rápidamente hace eco pues a las comunidades campesinas e indígenas, que son quienes inician el movimiento de defensa del maíz nativo y la riqueza biocultural que está asociada a esto. Esto es la autodeterminación del pueblo de México, que quiere el maíz nativo, que quiere sistemas agroalimentarios saludables. Y luego es a partir de esta voluntad expresa del pueblo de México que, pues primero no es escuchada durante 30 años de transgénicos en México, hasta que llega el presidente Andrés Manuel López Obrador, que en toda su trayectoria siempre habló de defender el maíz nativo y de la importancia de restringir el maíz transgénico, y es así como cuando llega a la presidencia hace pues esta serie de compromisos, medidas y acciones, ¿no? Esto entonces es un acto de soberanía alimentaria. Importante que las bases del decreto, su sustento es bastante sólido. Las bases jurídicas del decreto es la Constitución Política de los Estados Unidos Mexicanos, los tratados de derechos humanos, además de diferentes leyes federales y generales, pero también se basa en el derecho internacional, en el derecho comercial internacional, en el derecho ambiental internacional y en el derecho internacional de los derechos humanos, ¿no? Es además, o los decretos presidenciales, el del 31 de diciembre del 2020 y el del 13 de febrero del 2023, son instrumentos de protección de derechos humanos. Y eso hay que decirlo así porque eso es lo que es muy reconocido en la Suprema Corte de Justicia de la Nación cuando nos tocó defender los decretos, que voy a hablar de eso un poquito más adelante, ¿no? Entonces, ¿cuáles son estos? Principalmente, por supuesto, porque sabemos que los derechos humanos están interrelacionados, pero se enfoca principalmente en el proteger el derecho a una vida digna, el derecho a la alimentación sana, nutritiva, suficiente, de calidad, culturalmente adecuado, el derecho al acceso al agua potable, el derecho a la salud, el derecho a un medio ambiente sano, sin riesgos, limpio, saludable, sostenible, que ya luego Naciones Unidas le quitó esto de sin riesgos, y los derechos de poblaciones vulnerables como la niñez, la adolescencia, los campesinos y otras personas que trabajan en el campo y, por supuesto, los pueblos y comunidades indígenas. Y aquí entra justamente la importancia del principio precautorio, que en nuestro país es de ordenanza constitucional. ¿Por qué? Porque está reconocido el principio precautorio precisamente en los estándares internacionales de derechos humanos que, de acuerdo al artículo 1 constitucional, pues deben precisamente, junto con los tratados internacionales, el Estado mexicano debe de velar por ellos, ¿no? En cuanto al principio precautorio, estamos hablando de que para México es obligatorio porque está dentro de la observación general número 36 sobre el derecho humano a la vida del Pacto Internacional de Derechos Civiles y Políticos, que por cierto, ese es el único pacto que Estados Unidos ha firmado y por lo tanto debería también de observar el principio precautorio. Por supuesto, el derecho a un medio ambiente sano en la opinión consultiva 23, en la observación general de Naciones Unidas del Comité de Derechos Económicos, Sociales y Culturales sobre el derecho humano a la ciencia, en fin, ¿no? O sea, para México es obligatorio también la aplicación del principio precautorio. En cuanto a las bases científicas, estos decretos son muy importantes porque por primera vez reconocen que en efecto hay evidencia científica de daños y de riesgos, ¿no? Primero hablábamos de riesgos, ahora ya estamos hablando de daños, ¿no? En el CONACYT hicimos unos expedientes científicos y dentro de la CIBIOGEM unos compilados de información científica y estamos hablando entonces de más de 1,200 referencias científicas, ¿no? Reconocemos entonces los daños y riesgos asociados al maíz genéticamente modificado, incluso a la modificación genética per se, dado que se trata de técnicas imprecisas e ineficientes que derivan, ¿no?, en expresiones génicas y epigenéticas no deseadas. Tenemos, por ejemplo, el caso documentado del maíz NK603, que le hicieron este estudio a través de técnicas proteómicas y se detectó que la planta de este maíz transgénico, que es uno de los más diseminados a nivel internacional, produce una mayor cantidad de putrescina y de cadaverina. Pero también los efectos a la salud directamente por el consumo del maíz transgénico de tipo resistente a insectos y también los tolerantes herbicidas, ¿no? Particularmente los efectos de las proteínas CRI, que son tóxicas, producen procesos de inflamación, reacciones en el sistema inmune, estrés oxidativo, etcétera, ¿no? Y en cuanto a los transgénicos de tipo tolerantes a herbicidas, pues el hecho de que estos herbicidas se encuentren en órganos, músculos y fluidos de animales, pero también que se ha visto que afectan el sistema digestivo, la bioquímica del hígado, los riñones, etcétera, ¿no? Y por supuesto a esto hay que sumarle pues los impactos de los plaguicidas altamente peligrosos, así es como hay que llamarles.
2 minutos, Erika, perdón.
Perfecto. Con los que están indisolublemente asociados, glifosato, 2,4-D, dicamba y glufosinato de amonio, ¿no? Por supuesto, también el hecho de que los cultivos transgénicos están asociados a alimentos ultraprocesados, ¿no?, y comida chatarra. Esto ha sido documentado en diversas instancias, por ejemplo, en la Academia Americana de Pediatría. También, pues aquí tenemos, ¿no?, los riesgos asociados a estos plaguicidas altamente peligrosos. Tenemos cáncer, que actúan como disruptores endocrinos, daños al sistema nervioso, hígado, riñones, en fin, ¿no? Son innumerables aquí las evidencias científicas al respecto. También tenemos la calidad nutricional y propiedades nutracéuticas del maíz y que México es autosuficiente en maíz para consumo humano. Importante decir que los transgénicos no alimentan al mundo y no hay una preferencia generalizada o mundial hacia los cultivos transgénicos, a pesar de que la industria se esfuerza en afirmar que los transgénicos se siembran y se consumen en todo el mundo, ¿no? También que los transgénicos no contribuyen al ejercicio, al derecho a la alimentación, dado que no están diseñados para alimentar a los humanos de forma adecuada y tienen residuos de plaguicidas. Entonces, aquí reconocemos que no existe consenso científico sobre la seguridad de los consumos de los cultivos genéticamente modificados, ni sobre los alimentos hechos con ingredientes que los contienen, ¿no? Y bueno, considerar además algunos otros daños, que hay evidencia de las malas prácticas científicas de la industria biotecnológica y demás, ¿no? En México vivimos, con esto voy a concluir, presiones internas justamente al haber desafiado al oligopolio industrial. Por ejemplo, el Consejo Nacional Agropecuario, asociado con la agroindustria, pasó el sombrero para juntar dinero y demandarnos y también impulsar las campañas de desinformación y mediáticas basadas en falacias. Hubo una confrontación al interior del gobierno federal. Por ejemplo, hubo quienes no aplicaron el decreto, como Víctor Villalobos, ex titular de la Secretaría de Agricultura y Desarrollo Rural. Sencillamente, en cuanto al glifosato, no quiso difundir las alternativas que se detectaron en México. Tuvimos más de 30 juicios de amparo en contra del decreto del 2020 y 6 contra el decreto del 2023. La mayor parte de estos están ganados y sobreseídos, y en varios de ellos los jueces se metieron al fondo del asunto dándole la razón al Estado mexicano. Incluso Monsanto se tuvo que desistir de la demanda, ¿no? Y en cuanto a las presiones externas, la agroindustria y el gobierno de Estados Unidos también con estas campañas de desinformación, y aquí es en donde entró el panel de controversia sobre el tema del maíz transgénico en el TEMEC, que este panel, hay que decirlo, no se manifestó sobre el tema científico, únicamente vio si el decreto era o no compatible con las medidas que están establecidas en el TEMEC, que valga decir, pues están sesgadas, ¿no? Con esto concluyo. Muchas gracias.
Gracias a ti, Erika, una excelente presentación y la muestra de que cuando uno quiere desde la decisión política de un país establecer medidas que realmente busquen la soberanía alimentaria y prohibir el glifosato y los organismos genéticamente modificados que puedan hacer daño a la salud de su población, se puede, aunque con grandes presiones internas y externas, ¿no? Vamos a pasar ahora a una presentación conjunta, que es el ejemplo de Brasil. Sorry, I'm going to change to English because Karen is going to speak in that language. The first speaker will be Karen Fredericks. She has a PhD in toxicology and public health, is researcher at the Osvaldo Cruz Foundation, and leading health science and technology in Brazil, and at the Brazilian Association of Collective Health. Then is going to talk Jacqueline, that it's member of the MS. Jacqueline hablará en español. Ella es miembro del mecanismo de el Movimiento Sin Tierra en Brasil, coordina el Secretariado Nacional de la Campaña Permanente contra los Plaguicidas y por la Vida desde el 2014, y presentará cómo se organiza esta campaña, sus objetivos y quiénes forman parte de ello y sus principales formas de acción. Entonces, Karen inicia. A cada una les diré también cuando falten 2 minutos para que empiece la otra. y Karen nos contará también su experiencia con los organismos genéticamente modificados en Brasil. Adelante, Karen.
Good morning or good afternoon. I hope you see my screen.
Yes, perfect.
Oh, not anymore.
Not now. Yeah, exactly, not
Not
anymore.
now, sorry. Okay.
And we can't see you very well.
Here, I don't know what happened with the zoom of my screen. I'm trying to
Don't
manage,
worry.
but I'm so
The presentation
sorry.
is okay now.
It was working 2 minutes ago. So thank you, Cecilia, for the presentation and Nicoleta for the invitation. And I just want to say sorry for the interpreters because of my English is not very well trained. And here I will talk about the use of pesticides and glyphosate in Brazil. Pesticides in Brazil, we consume more than 700,000 tons of active substance. This occurred in 2021. In 2022, it was 800,000 of tons of active substances. It's not the formulated product. This is the data that we have in Brazil. It's not the final product because these are data exclusive to the industry. And we have 75 million of hectares planted with soybean, corn, cotton, and coffee. Those are commodities. It represents 83% of total planted agricultural area in Brazil. As my colleagues before, they are not food, okay? Coffee is maybe indispensable for most of us, but they are not food like rice, beans. And what we are seeing in Brazil is in the last 10 and 20 years is the decreasing of planted agriculture area for food, for the real food that we eat, that are vegetables, fruits, and rice and beans. That's very common in Brazil. It's very popular for us, as corn are in other countries. It represents 80.8 kilos of these substances per hectare of harvested area. Some parts of Brazil, this number reaches more than 100 kilos per hectare. And here we can see 80,000, more than 80,000 poisoning cases in 2019. Approximately 20% of children intoxicated with pesticides and 7% of teenagers. Those are people that are developing their endocrine system, their immunological system, their metabolic system, and this is the effects on this period of life, as well as for pregnant and people with some chronic diseases. It's very, they are more dangerous, more harmful. And 8% of pesticide sales in Brazil are designated to those cultures that are not food. Here in Brazil, we have a very sad experience with aerial, terrestrial, and coastal drift. Here in the center of the screen, we can see a red arrow. This represents a school, a rural school for kids and teenagers, and surrounded by corn and sometimes soybean planted here just beside the school. And what happened in 2013, it happens all the time, unfortunately. An airplane passed and drifted pesticides several times over the school. because he wants to reach the plantation of corn, but it reached the kids, the workers from school, and more than 80 people were intoxicated. Here we can see another effect. Here in the left part of the screen, we can see this red line that is showing Guarani Kaiowá, that's an indigenous people living just besides a road. You can see here in the right side of the screen, kids, indigenous kids, living and playing just beside a road, very, very important road. And here we can see corn in one side and soybean on the other side. So those were territory of these indigenous people, and the soybean, I should say that our GMO soybean and GMO corn just push them to the road, so they cannot leave. This is very common in Brazil as well. Drift of a tribe of Chavante indigenous people.
Karen, so you have 2 minutes.
Okay, those are other consequences. Here we have 81% of pesticides authorized in Brazil are not authorized in at least 3 OECD countries. Those are a research that we made. This number 67 represents the total, volume traded in Brazil that fits at least one criteria related to carcinogenic and the endocrine disruption to human health and wildlife, according to US EPA, EARC, and European Commission positions. So besides we use a huge amount of volume, we use a huge amount of very toxic pesticides in Brazil. And most of them are used in Brazil for more than 50 years. And of course, this use is associated to plague and antibiotic resistance. We had a change in regulation of pesticides in Brazil. I will let the slides for you. I won't be able to talk about all of them, but we have, for example, the preventive application of pesticides. That, of course, it dialogues with the antimicrobial microbial resistance, because if you apply them before the plagues, of course, it will induce resistance. So the perspective, the future in Brazil is even worse after this approval of this bill last year. Here we also discuss about the limits of risk assessment, as Angelica talked to us. Of course, here we can see 2 pictures of a famous photographer in Brazil, Sebastião Salgado, showing how other social determinants influence in the toxicity and the disease that those people, especially in rural area, show. Here I showed it before. And
yes.
this
sorry, we need to finish.
Okay, just the last slide to show that we made a research in 12 years in Brazil, showing that the use of herbicides, GMO here in Brazil, since the approval here, we showed an increase of glyphosate use, of course, and it doesn't represent an expression in productivity. To increase 1% of productivity, we should increase 13% of pesticides. So it's not a model very sustainable. And that's all. Thank you.
Thank you. Sorry for the hurry, but tenemos muy poquito tiempo. We have a little time now. So we are going with Jacqueline, please. Jacqueline, you are there? Perfect.
Hola,
Perfecto,
hola,
ahí vemos
hola.
bien. Hola, Jacqueline.
Buen,
Buen día.
buen
Bienvenida.
día, buenas tardes, muchas
Buen
gracias.
día.
Perdón, porque también no hablo español, hablo un portuñol. Vamos a tentar acá nos comunicar. Bueno, muy rápidamente, la propuesta acá es de complementar la presentación de Karen. Con la experiencia de la campaña permanente contra los pesticidas agrotóxicos que usamos acá en portugués, en Brasil, y por la vida, ¿no? Una campaña construida há un poco más de 13 años, que se lanza en Brasil en Día Mundial de la Salud, que tiene como una principal tarea y misión la comunicación con el pueblo brasileño sobre las contradicciones de agronegocio, en especial los impactos dos agrotóxicos en la vida de las personas, medio ambiente y todo más. Nuestra campaña é uma organização é uma rede, né, uma organização da sociedade civil que trabalha na missão de la denúncia, pero também do anúncio a partir do amplo movimento e trabalho em torno da agroecologia. Então, ela tem recorte muito importante que não basta ser contra los transgénicos, los agrotóxicos, mas necessário se profundizar mais o debate da questão agrária, da defesa dos territórios, de toda a luta campesina, indígena que se queda em nosso país, em nosso continente. E estes são os símbolos, os nomes das principais organizações que coordenam a campanha em Brasil. Então, Associação Brasileira de Agroecologia, Associação Brasileira de Saúde Coletiva, Central Única dos Trabalhadores, né, sindical, rede de médicos e médicas populares que principalmente que atuam na rede de saúde pública em Brasil, organizações de direitos humanos como Terra de Direitos, os movimentos campesinos articulados em La Via Campesina, Sin Tierra, pequeños campesinos, mujeres camponesas, pueblos indígenas. Hay una gran diversidad de actores, de sujetos colectivos que juntos construyen la perspectiva de trabajo de campaña en Brasil. Un foco muy grande en la comunicación, pero con pasar de los años fuimos implementando frentes de acciones para avançar com a luta contra os agrotóxicos. Como Karen já apontou, eu não vou me prender muito a números, né? Mas o Brasil é dos maiores consumidores de pesticidas do mundo. Acá algumas das informações que utilizamos para trabalhar com a população, com dados sempre muito concretizado em torno das nossas principais organizações de pesquisas. Então, se utiliza muito essas informações para fazer trabalho de base com as comunidades, com os pueblos, a argumentação jurídica, institucional e tudo mais. Perdão que algumas coisas estão em português aqui. Aqui Karen já apresentou os destinos mais específicos de los pesticidas em Brasil, o que nos mostra muito claramente a força o principal responsável, o modelo de produção do agronegócio, o principal responsável da questão da contaminação dos agrotóxicos. O recorte mais específico é o glifosato. O glifosato é um dos ingredientes ativos mais utilizados em nosso país, em nosso continente, mais vendido, mais comercializado em Brasil. Karen também já apresentou a relação com o câncer, com as mortes dos ninhos, de toda essa relação. Acá em Brasília, o Instituto de Defensa do Consumidor fez uma pesquisa, um estudo, com a presença do glifosato em nossa água. Então, a água do povo brasileiro está muito contaminada e o nosso índice de limite permitido é 5.000 vezes maior do que o respeitado em la União Europeia, por exemplo. Em relação à presença de glifosato em nossa comida, em alimentação, né, da maioria das pessoas, revelou que 58,3% dos alimentos ultraprocessados de origem animal em Brasil, como empanadas de pollo, de queso, entre outros, com resíduos de agrotóxicos, em especial glifosato, cereais matinais e tantos outros. Acá também
2 minutos más, Jacqueline, perdón.
Perdão. Eu quero trazer acá uma importante movimentação que nós contribuímos junto com os países acá em América Latina em torno de uma denúncia que construímos de um projeto que está em andamento contra a multinacional Bayer, né, que depois que ela adquire a Monsanto em 2018, a empresa posicionou como líder no mercado de pesticidas em América Latina. Então, 67% das semilhas transgênicas da Bolívia são de Bayer, 44% de Brasil, 39% em Paraguai, 38% em Argentina. Os plaguicidas à base de glifosato têm se tornado os plaguicidas mais utilizados em todo o Cono Sur, então não é só um problema de Brasil, né? Argentina, Brasil, Bolívia e Paraguai representam mais de 99% da produção de soja em América do Sul. Então, é uma realidade muito presente. A campanha se fortalece em torno de umas bandeiras de luta, que é o fim das fumigações aéreas, proibição dos pesticidas já proibidos em outros países, o fim da isenção fiscal para os pesticidas, que é uma pauta muito importante, e a criação de zonas livres de pesticidas e OGMs. Trabalhamos com formações em territórios e comunidades e grupos, formação política, informação. Também nos organizamos em torno da influência política, que chamamos de incidência. Trabalhamos com política pública, com um fortalecimento dessa rede em torno do parlamento em Brasil e todo esse acompanhamento com as províncias. Acá, um trabalho mais em torno da questão jurídica. Temos um coletivo jurídico que se debruça em avançar na proteção e luta institucional e jurídica de cobertura às mais diversas violações de direitos humanos que se dá por agrotóxicos. A comunicação, um pouco de nossos materiais, depois vamos compartilhar nosso website. E as relações internacionais como um pilar muito importante, que acreditamos ser bastante expressiva a participação da campanha nessas articulações, e mais uma vez agradecer a presença acá num evento como esse, e temos uma expectativa muito forte de podermos implementar ações que compartimos, como também criar outras formas de resistência nessa compreensão dos pesticidas como um problema geopolítico, e que vivenciamos uma crise general de capital e que se aprofunda, se empeora cada vez mais. O conflito muito presente na vida dos povos, em especial dos países países do sul global. Algumas questões também que queremos apontar acá e que pensamos ser importante nesta articulação internacional, que hacemos o debate com as organizações acá em Brasília e América Latina, que organismos multilateral de fato é capaz de implementar uma regulação efetiva hoje, né? Se considerarmos todos os aspectos que passamos da crise, da humanidade e todos os conflitos. Uma questão que estamos também na articulação internacional tentando fortalecer é a responsabilidade das empresas de de pesticidas, como foi o caso da denúncia contra Bayer em OCDE em Alemanha, para que possamos avançar nesse sentido de la lucha por direitos humanos e la responsabilidade. E acá em Brasil, nosso também desafio é em relações a essa relação sua com a luta contra os pesticidas, né? Avançar nessa articulação internacional com nossos vizinhos e a Via Campesina, as organizações que estão mais acerca e que também podemos fortalecer enquanto continente, enquanto grande região, nesse trabalho. Há muitas coisas mais, mas, em geral, creio.
Gracias, Jacqueline. Necesitamos terminar. Gracias.
Thank you so much for this fantastic overview and daggering figures that have been shared. I think as we were chatting with one of the participants, these are struggles that have been going on for a long time in many parts of the world, but we need to continue taking stock of the new elements or new developments that may, come to the fore. We cannot afford to give up, and we must continue the fight, perhaps even more strategically, like Jacqueline has shown us. A lot can be done from the ground, from the grassroots upward. Now, there are a few questions, and I would like to, on the chat, I would like at least to pick up a couple of them, which were addressed to Angeliki from, one from Bill Jeffrey from Canada, about the Pan-Europe case, asking if you were able to obtain the industry-supplied data in machine-readable format to conduct your analysis, Angeliki. Did you have to convert the PDF tables to spreadsheets or statistical databases to double-check calculations? The 2017 application package for glyphosate included 89,000 pages of data and text and strict restrictions on the third-party access and use. So this is the first question, but I see another one from Ashka Naik from Boston Corporate Accountability. Were you able to look into the impetus behind what seems a deliberation overlooking for independent science by the EU bodies? Often, the smoking gun is deep conflict of interests within decision makers. So wondering if you found any conflict of interests that could taint their decision, potentially biased or influenced by the industry. So also, I think it's important to discuss or to present the fact that the procedure for obtaining standing for CSOs in the European Court of Justice is a new pathway. I think this has not been highlighted sufficiently. I would stop here for you, Angeliki, so that you may quickly respond. And I would also ask you the patience for extending maybe 10 minutes, a little bit, this conversation, because we had a variety of presenters and very important cases. Thank you very much, Angeliki, if you take the floor and quickly answer these questions.
Yeah, just on this, just to say that the fight for disclosure of the industry studies has been a long one for us. So what we did manage this time to get the full access to the studies, but this was also because we have a new regulation, the transparency regulation. After fighting for this for many years, they did say that the industry studies have to be in the public domain. And yes, the way they are in PDF, so they're not all of them necessarily in Excel sheets, so they're not as user-friendly as you would like them to be. But in this specific case, there was also done through freedom of information to the EPA. So this was already done by some scientists. And then the ones that we look, the summaries of the results of the hundreds of pages, they were in PDF format, and we had to make tables. So it wasn't, it was a laborious work. So we had to pass all the data from the PDF to Excel tables. So it wasn't user friendly. They didn't make our job easy. But at least compared to the 2017, this time we did have access to the studies. So on the conflict of interest, they're everywhere. We know that the guidance documents that some of these, let's say, unwritten rules that they decide within these committees, they're being pushed by the industry themselves. We see a pattern, like for example, we see this like they do an animal study and they find adverse effects, and then they decide that they're non-relevant for humans. And this is something that has been promoted a lot from the industry. So they now we have to check the relevance for humans, although the law says that we have to protect both humans and animals, but suddenly this disappears. And also we now saw, for example, in they used a lot this academic this review from this scientist that has worked a lot for the industry. So he has worked with asbestos, lead, so all these tobacco industry, diesel. He has written for all of them that carcinogens can be safe, and not surprisingly, he also wrote for glyphosate. But what it was surprise for us was how, like, the work, for example, for really renowned scientists was downgraded, and then suddenly this study of this guy that is clearly working, he has a conflict, even if he's not exposed that he's being paid, which he has been paid from the industry, but maybe not from Bayer. But you can see his ideology. They took into account his studies. So yeah, you can see a clear pattern. But then, for example, when we look at the people sitting in EFSA, which is the European Food Safety Authority, that they're doing the risk assessment in Europe, we don't see that these ones are directly linked to the industry. So it's all indirect. It's either people that they were working for the industry and they have drafted guidances that they are being used, or they were working before. It's the revolving doors that, you maybe 5 years afterwards you go to work for an institution, and then you don't have a conflict of interest, but evidently your ideology is aligned with the industry. So it's a bit more difficult to cut the let's say the bias. But this is a work that we're really digging into in our organization to try to expose like these people, as not scientific. And I think the last one, yes, it's because we have a change in the law. I'm really sorry I didn't say this, but it's an opportunity that was given to us since 2020, is the ARUS regulation, where for civil society can have access to the European Court through this pathway. So we have to first request a review of a decision, and then if the European Commission denies it, we can ask the court to intervene. And this is exactly what we've been doing. We have a few court cases on exactly using this channel, legal, let's say, pathway. And it's a new thing, so I cannot give you much feedback on what we have achieved on this, because it's still we are testing it. Yes, but it's a really important tool for democracy.
Thank you so much, Angelica. I totally endorse this idea that the strategic litigations, the legal pathways are useful to densify rules of the game, legislations, regulations, and they are also very helpful for democracy and for good science as well, I guess. There's another question from Michael Musenga from Zambia. Hello to everyone. Can strict measures, laws be done by support from the WHO, especially at the national level? Michael, if I may, I mean, I don't know if anyone wants to respond to this. Jane, maybe from Uganda. Uganda is looking for national legislation. You know, the civil society is asking Uganda for national legislations. If anyone wants to comment, the one thing that I can only say before giving the floor to any of the panelists who want to answer is that this is precisely the reason why this webinar and this conversation has started, because we really need to wake up the WHO in this regard. I don't know, Jane, if you want to say something on this, or anyone else, or Mexico also, I don't know.
Okay, maybe when it comes to national legislations, it's also a big struggle. But it also gives us a chance to fight and to raise awareness. There is a GMO bill which has been on the table for almost now 15 years. So in a way, they give us a chance to fight, but it's a really, really hard fight, because the other side also is supporting the legislators, taking them to see those plantations, you know, so it's a fight, but it's a fight which we'll have to.
Thank you very much, Jane. And, you know, when you have mentioned health very much. Well, be aware that these conversations do not belong to the global public health debate. They don't belong. They simply don't happen. There is such a disproportionate attention on access to medicines, which of course is important, but only one part of the wider and bigger you know, chapter around public health, and that is basically to rebalance a little bit, especially after COVID and COVID teaching, you know, the lessons from COVID. We need to really reassert these parts, these elements of the conversations. I see that also people are basically saying, like Patty, I'm just sharing bits and pieces from the chat, that these are very much, very, very relevant arguments that are being discussed at the Codex Alimentarius and the WTO debates. So there are more than, you know, it's not only the UN that is the place to discuss this. And yes, Alison, we need to really challenge this probable word in the IARC definition today. And unfortunately, the WHO people could not come for the meeting as we would have wished, but we are going to have meetings with them after this webinar, and we will share the podcast of the webinar for them, because they need to understand what real science is about. I don't know if there are, conflict of interest and revolving doors, as Jane was mentioning, and also Angeliki, they're everywhere. This is a struggle that people working in WHO know very well. And I don't know if the executive board agenda item will be an opportunity. We have to make one out of that discussion. I only fear that much of the conversation at the EB will be, in a way, drowning into the US administration to exit the WHO, but we have to densify these topics, and I really invite you all to follow also the sessions of the EB Today that the Geneva Global Hub organizes every day during the EB, which is going to be from the 3rd to the 11th of February. We organize specific sessions close to civil society organizations to brainstorm, to strategize together, to make agenda items meaningful topics for advancing the public health agenda. Yes, I think also, Karen, you're mentioning the fact that supporting each other and, you know, Brazil and Uganda, but I think there is so much to learn from Mexico. That's why I keep on inserting Mexico everywhere, because Mexico tried with a beautiful vision of self-determination, of a policy vision that we so much advocate for, and that is so important. So I think it's impossible to answer to all the inputs, so I would now give the floor to Cecilia for the concluding remarks and also some projections for policy demands that we collectively must cherish and nurture together. Cecilia, you have the floor to conclude.
Muchas gracias, Nicoleta. Creo que ha sido un gran éxito el poder presentar las experiencias de tres áreas, Europa, África y Latinoamérica. Quiero agradecer igual, primero porque vi que estaba ahí por el chat, a Fernando Bejarano de PAN Latinoamérica, quien hizo difusión de muy buena manera de PAN Europa y lo que nos contó Angélica, y llegó a mi correo, y eso detonó que de alguna manera Nicoleta y yo nos tomáramos la decisión de abrir este diálogo político para insistir en la importancia, como se dijo, de trabajar en transformar los sistemas alimentarios en el ámbito mundial. Como podemos ver, cada uno de los casos presentados hoy en este webinario, los países enfrentan duros confrontamientos internos y externos, como dentro de los propios gobiernos y con las transnacionales, tanto en Europa como en África y Latinoamérica. La violación del principio precautorio y de los derechos humanos es muy, muy fuerte. También veo que las propuestas de cada país coinciden con lo que México viene haciendo, y quiero tomar esta oportunidad, como decía Nicoleta, de hacer una propuesta que México ha presentado innumerables ocasiones en el ámbito internacional, pero esperando que la OMS pueda escucharnos y se logre que lidere este proceso. En el ámbito internacional, México, ante el Consejo de Seguridad Alimentaria Mundial, desde el 2019, ha planteado una propuesta desafiante, tanto a la FAO como a las diversas agencias internacionales de la ONU presentes en el CSA, para que se tomen liderazgo audaz y se alejen de esa pasividad que Nicoleta nos hablaba al inicio para la regulación global de los sistemas alimentarios, teniendo como ejemplo justamente lo que comentaba Alicia, del convenio marco que hizo la OMS para el control del tabaco, que es el primer tratado negociado bajo los auspicios de la Organización Mundial de la Salud. Y bueno, y hemos propuesto la creación de un grupo de composición abierta ante el Consejo de Seguridad Alimentaria para abordar esta crisis actual y las múltiples crisis que vivimos y que nos dimos cuenta durante la pandemia. Este grupo de trabajo, la idea es que debe trabajar en las cadenas de valor de los sistemas alimentarios para construir una regulación internacional desde la producción al plato, como decía, como el convenio marco de tabaco. Ese convenio tardó en concretarse 10 años, entonces sabemos que no es una tarea fácil, pero mínimo, y son temas que hemos hablado aquí, que esa regulación debe incluir la regulación, valga la redundancia, de los agroquímicos altamente peligrosos, incluyendo el glifosato, el etiquetado frontal de alimentos ultraprocesados, la implementación del Código Internacional de Comercialización de Sucedáneos de Leche Materna, que hemos hablado mucho aquí del Códigos Alimentarios, e incentivos para la transición agroecológica sin organismos genéticamente modificados ni agroquímicos, que es lo que habíamos hablado ayer. Es decir, una regulación global homogénea de los sistemas alimentarios desde la producción al plato, que apoye para que todos los países no tengan, o sea, puedan defender mejor ante estas presiones que reciben tanto interna como externamente. Esto debe crear mecanismos globales que impulsen la autosuficiencia alimentaria y la soberanía alimentaria a través de la producción agrícola sostenible, mediante el uso de prácticas e insumos agroecológicos que resulten seguros para la salud humana, la diversidad biocultural y el ambiente, incluyendo la necesidad urgente de regulación global del uso de agroquímicos altamente peligrosos. La FAO no ha tomado este liderazgo, pero podría ser la OMS quien lo tome y se avance sectorialmente, interagencialmente hacia la transformación mundial de los sistemas alimentarios.
Gracias, Cecilia. Thank you all. Thank you very much to the interpreters, Cecilia and Maria Jose, who helped us, extend the comprehension of this complicated, intricate, but necessary, indispensable debate. And I definitely want to express the gratitude for keeping you here longer than expected. I think it's important to continue this. We will not stop. And if it is necessary, we will have another debate. We will not be, once is nothing. We need to insist and continue. I think from out of this conversation today, new alliances and new synergies needed to be set in place. I hope that SID and Seatini and Ecosur will facilitate this with also support to Pan-Europe, which is really going through a very difficult and thorny pathways. You need everybody's support in this, including financial, I think, because it can't be a joke to have a strategic litigation against Monsanto and Bayern on these topics. So we will continue. The webinar has been recorded and you will have it available on the G2H2 website. So please use it. Use it for disseminating the conversation, for also being continuously inspired by the things that we've heard and the staggering numbers that we've heard today. I really, once again, wish to thank friends from Africa, from Europe, from Latin America, and particularly I want to thank my fantastic co-moderator, Cecilia, who has really been a great help, Alice and Alessandra, for making this thing happen today. Thank you all, and more to come. Bye-bye.
Thank you all.
Thank you.
Bye. Bye-bye.
Bye.